It's California Edition. My name is Brad Pomerance. We are joined by Dr. Christopher Fichtner. He is a professor at UC Riverside Medical School, also the author of this book, Cannabinomics, which came out in 2010. In a lot of ways, I think you were prescient in this book. Talk to us about the thesis.
Well, basically, the idea was that the argument was that we were at close to a national tipping point on marijuana policy.
Right.
And based on kind of a reading of the tea leaves, if you will.
Or marijuana leaves,
yeah,
right.
Looking at kind of a convergence of three different, I call them policy trajectories. One was the growing consumer demand for access to cannabis as medicine.
Right.
Second was kind of a growing disillusionment with the lack of success of the drug war, particularly with a lot of the violence that we're seeing on the border and in Mexico. And then the third was really the economic crisis and a realization that there may be better ways to manage this particular commodity.
I read recently that a hedge fund is literally investing in kind of marijuana futures. Yeah. I mean, who would have thunk even in 2010? And I'm going to be candid with you. If you would have said to me in 2010 that we were really heading towards full legalization and that we would have gay marriage, I mean, those two issues 5 years ago, I would have said you're crazy. But yet, these last 5 years on those two issues, totally unrelated, of course, but in my mind, remarkable on so many levels. But your thesis goes further. Your thesis is that the liberalization of marijuana policy is a public health benefit, not detriment. And that's what I want to really explore. Why is it in your mind that you believe that the liberalization has been beneficial?
Well, in the book 5 years ago, that was really part of the second trajectory that I mentioned, really a drug war, public health trajectory. The idea being, and it was really informed a lot by what was going on then in Colorado. They had a movement called the Safer Movement. It was led by Mason Tvert. Began with change in the law in Denver in 2005, and then later they tried to take it statewide. They weren't successful, but their argument was that based on all the available science that cannabis use can be seen as safer than alcohol, and there's a number of points you could make in that area.
Look, anecdotally, and it's just anecdotally, go back to high school. Think about the stone kid in the corner. Think about the drunk kid in the corner. Who's going to cause more trouble? The drunk kid. I mean, it's undeniable. Why is that? Medically, why is that?
Well, as you may know, former police chief from Seattle, Norm Stamper, made the point that alcohol is frequently associated with violent behavior and marijuana is not.
It's associated with sleep or eating. You know, it's just, and I don't mean to make light of it, but at a certain point, I do think kind of simplifying the conversation is important. Because in a lot of ways, we just need, as a society, to come together. Look, I'm not taking a position by any stretch, but it's hard to deny that we're kind of headed toward, likely we'll see a ballot initiative in California to completely legalize it, if not 2016, 2018. Colorado's already legalized, Washington State's already legalized, Alaska's decriminalized. I mean, we've essentially decriminalized.
Yeah, frankly, I was a little bit surprised that Colorado got there before California, but it actually makes sense that it happened that way. Colorado's a smaller state. But
the news out of Colorado, you know, it's hard to really get a sense of that laboratory. You know, anyone could say anything. And, you know, as a doctor yourself, as a clinical professor, what do the bona fide studies tell us out of Colorado?
What I wanted to go back and mention was, even though, you know, I had ideas about this in 2010 that I wrote about in the book, more recently, some of these issues have begun to be studied. There's several studies that came out within the last year and a half, some of them very recently within the last few months. One of the studies found that looked at suicide rates in states that had passed medical cannabis laws, medical marijuana laws, compared with those that had not passed them, and found that at least for males age 20 through 39, that there was a significant drop in suicide.
So as a psychiatrist, I ask you, is marijuana effective in terms of treatment for depression, anxiety, those are symptoms that can often lead, I mean, especially those two in the severe forms, those can lead to suicide. It's undeniable.
Yeah, I mean, I think we need more studies before I would really just go out on a limb and say it's effective. I mean, most of the practice that I do as a psychiatrist, I use pretty standard evidence-based
the SSRIs.
treatments. Yeah, the SSRIs, mood stabilizers if they're necessary, antipsychotics, the typical lineup of psychiatric medications. We do know that elements of cannabis, and probably cannabis itself as a whole, has anxiolytic or anti-anxiety properties. We do know that. Even THC, which if you get too much of that, it's the sort of primary component that is responsible for the marijuana high. And sometimes if people get too much of that, they can become more anxious, actually develop panic attacks. But in low doses, it can be anxiolytic, in other words, lowering anxiety level. The other component, there are many components in THC, even many cannabinoid substances, but one of the ones that's attracted a lot of interest in recent years is cannabidiol, or CBD, and it is non-psychoactive. It does not get you high. And there's a fair amount of data from experimental data with humans, with subjects, showing that it reduces anxiety. And there's actually at least one study that's a controlled study in schizophrenia patients.
Really?
Comparing it, this is in Germany, not in the United States, but comparing it to a standardized antipsychotic, and it actually did just as well for the control of psychotic symptoms with a better side effect profile. So certainly some of the components in cannabis have potential psychiatric applications. I think they need further study.
What about inhalation? Do you need to inhalate it as a smoke for it to be effective in your mind?
Well, first of all, it can be consumed in various ways. Some people use edibles. Those can be difficult to predict. And
because
absorption can be different people. It can be a bit unpredictable, and you don't always know how much you're getting in those edibles. Some are labeled, whether the reliability of the labels may be better in some cases than in others. Other people prefer to use liquid extracts. They call them tinctures. They can be sprayed under the tongue or administered with an eyedropper. But for certain things that are more acute, the inhalation route may be preferable. But of course, it doesn't need to be smoked. It can also be vaporized, which is a vaporizer, and you see those around now, even for people that are using tobacco.
Vaping?
Yeah, vaping, which is often used in the context of tobacco smoking now too. Instead of smoking, they're vaping.
Because I think back to the good old days, not that I consumed, but look, the goal was to keep it in.
Right.
And I can't imagine that's good for your lungs in terms of just the impact on lung health.
The thought is that the tars that result from burning plant material may be some of the most carcinogenic components in anything that's smoked. So that's true with tobacco.
Right.
As it turns out, the studies with cannabis really haven't been able to show that it increases the risk for cancer. There's even a few studies that suggest it might provide a protective effect. There's at least one study that shows that marijuana users had lower rates of head and neck and lung cancer.
What about those studies as it relates to overdosing on any substance? How does the legalization, liberalization of marijuana impact those rates?
Well, one of the other studies, I mentioned the one about suicide. There's one study, very, very recent, I think just came out toward the end of last year, in JAMA, Archives of Internal Medicine, Internal Medicine, so a
very
reputable journal. And they looked at opioid overdoses, which, as you may know, it's really considered that we have almost an epidemic of it in this country. A lot of, not just heroin, but even overdosing on prescription opioid narcotic analgesics. And virtually every medical cannabis patient who uses it for pain that I've ever talked to has said that one of the benefits of their use of cannabis is that they don't have to take as many opioid narcotic analgesics, things like Vicodin,
and
Norco,
what
those
we've
kinds of
seen in these studies, as we conclude, is that opioid overdose has dropped in those states.
In the states, the point of the study was that in the states that have passed medical marijuana laws, the opioid overdoses have dropped significantly.
I want to thank you for joining us. Come back. I want to hear more as studies continue to trickle out. His name is Dr. Christopher Fichtner. My name is Brad Pomerance. It's California Edition.